Hello, everyone, and welcome to our lunchtime chat today. How many of you have had a bad hair day? I know for me, my solution is always pulling my hair up into a ponytail and then calling it a day. Well, just imagine if the problem lasts for more than a day, a week, or even a month. The emotional turmoil that can result can be absolutely devastating for many, and very few people talk about how it's addressed. So, that is the focus of today's chat. My name is Dr. Crystal Porter, and I'm a hair scientist and owner of Main Insights, a company that conducts research and focuses on the hair needs of people from African descent. This platform is designed to elevate the Black hair care industry and empower consumers and hair professionals with education that is driven and backed by scientific research. Before we get started, I'd like to know who is out there today. Please let me know where you're from and also what category you fit in. Put the number one if you are a practitioner, put the number two if you are a consumer, and if you are a scientist or a researcher like me, put the number three. Also, I'd love for you to like and share this broadcast. There may be some other people out there who would benefit. Thanks, Dana, for coming. Hi, Taria. Really appreciate it. And then Margaret was on early. Thanks for joining, Margaret. Good to see you. All right. And Taria is watching from St. Thomas. Awesome. And then Margaret says she's from Atlanta, Georgia. Cool. All right. So if you are frustrated with the lack of information out there available to you when it comes to caring for your hair, and you've wasted a lot of money, time, and resources just trying to figure things out on your own, then you are at the right place. And that is why we've created the Our Black Hair Matters movement. Now, I have put together a very valuable resource called The Three Biggest Mistakes to Avoid When It Comes to Caring for Your Curly Hair. And to get it, you can go to ourblackhairmatters.com and you can see it on the ticker down on the screen below. And if you have a pressing concern and you'd like to have a conversation, I have a team that is standing by, and you can schedule a 15-minute free consultation by going to bit.ly/OBHM consult. Now it is time to get started. And I would like to welcome Miss Donecia Sullivan to join me as we have had like numerous discussions about her experiences and her perspective as a trichologist. So, hey, Donecia.
Hello, how are you?
Pretty good. So, I'd like to do a deep dive so we can learn about your unique offerings and to get into the psyche of your clients so that it may help hair loss sufferers. And then also your approaches, just dive a little deep into that because some of the ways that you help people may assist other professionals as well. So I want to thank you for being here. And before we jump in, I'd love to give some information about our guest, Donecia. So I'll read her bio now. So Donecia is a certified trichologist with over 18 years of service providing hair loss prevention and restoration for men and women who suffer from alopecia. She is licensed in the state of Georgia and North Carolina as a master cosmetologist, currently owning a hair and scalp treatment center in Augusta, Georgia. As a hair loss specialist, Donecia also provides non surgical hair replacement services to hair loss sufferers that are experiencing permanent hair loss. She is a strong believer in the power of improving hair and scalp wellness with proper care. To further her efforts in assisting individuals with hair and scalp health, she has become certified as a clinical research assistant with Chicago State University and has partnered with Save Our Scalps to conduct research on scalp wellness. Donecia regularly develops internal wellness campaigns to assist hair loss sufferers with effective hair and scalp health techniques. She enjoys a good Netflix binge and can also be found exploring on road trips with her family.
Yes, yes.
Awesome. So not only are you a professional, you like to have a little fun as well, right?
Love to have fun.
Awesome. All right. Now we've had some other people join. So we have Shirley McDonald, who is a trichologist. We have Judy, who says hello. We have Sydney, who says hello. So thank you guys for joining. Really appreciate it. So, is there anything I missed on your bio that you'd like to highlight?
No, I think you covered it very well. Thank you for having me, Dr. Porter. This is a great opportunity to be able to help and reach out to as many people as possible, especially those that are experiencing hair loss and they don't know what to do. And as you mentioned, it can go from today, the hair may seem a little thinner and they can't put it in a ponytail to now they have hair loss that is significant and they don't know what to do. So I'm happy to be here to be of assistance to them, to help them in their situation. So I think you covered it well. We offer the non-surgical for hair loss that is permanent, or even if it's temporary, we can still provide the wig prosthesis to help assist with that, and then the scalp and hair treatments and therapies.
Okay, awesome. So I ask this of all trichologists who come on because I think everyone has a unique story that is the background as to why they became a trichologist. So, what's your unique story?
Okay. Well, I became licensed as a cosmetologist in 2003. And practicing cosmetology, I was more concerned with hair care, the hair health, being, the strength of the hair. And I found that over the years, I would have clients that needed more assistance than what I could provide. And so I wanted to understand the severity of hair loss, what caused it to get to the severe state, and then what solutions were practical to help with that. So I had to do some research. I did some digging and started doing some studying, and I found the world of trichology, and it's been on ever since. And so studying trichology has given me the tools that I need to be able to help those with moderate to severe hair loss, and that are experiencing hair and scalp concerns, and that need practical solutions.
Okay. So, how do clients typically find you?
Good question. So I think now, with all that's going on, there are more and more people that are looking for help with their shedding, thinning, breakage. And so I get a lot of people that reach out to me through Google. They'll go through Google search. And then I also have quite a bit of referrals from the community, because again, I've been in hair care for over 18 years. And so I do have a reputation in the community for hair care. So I get a lot of referrals that way. And then also doctors and dermatologists. So I do get referrals from them as well, to be able to help with the hair loss concerns.
Well, that's really good. One of the problems that I hear from trichologists is that they don't have a lot of physicians who will partner with them. And I want to talk about that a little bit later, but that is something that is good to hear, that you do get referrals from that profession.
Yeah.
I'd like to know, like, what type of problems do your potential clients have when they are reaching out to you? So they reach out to you and they say, okay, I'm having XYZ problem. How
Mhm.
does that look?
So a lot of times it is thinning or breakage or a lot of shedding. And in over the last few months, it's been more and more individuals reaching out because they're getting a lot of shedding and they don't know what's going on. It's been going on for a couple months. They're noticing that the hair is not regrowing as fast as it's shedding out, and so they want to know how to stop that shedding, or how to get the hair to get back to a healthier state. And then I also have individuals that reach out to me just for a better understanding of how to manage their hair. They may have experienced hair loss over the years, and they are looking for solutions as to how can they better style it now, after the fact. Um, Also, if they're having some itchy scalp or excessive flakiness, they want to get that resolved as well. So I get quite a few people that reach out to me looking for solutions for scalp concerns as well.
Wow. Yeah, so sometimes people think they have a problem.
Mhm.
They'll describe a particular problem, and then you see them face to face, and then they may have another problem. And so, how many of these people come to you with like a diagnosis? So, it's good that you get referrals from physicians, but I'm sure that there is a percentage of people who contact you who don't. So,
Yes.
two questions in that. Do a lot of them come with diagnoses? And then for those who don't, then how do you go about, helping them? Because it's hard to help someone if you really, I mean, you can see some things with the naked eye in terms of, what you observe, but then it's another thing to have a diagnosis. So how many come with a diagnosis? And then for those who don't, how do you go about helping them?
Okay. So I get more people that do not have a diagnosis than those that do.
Okay.
Those that have a diagnosis, we start from there. So, whatever the diagnosis has been from the dermatologist or the doctor, I identify what's going on currently. And depending upon how long the diagnosis was, then we move forward from there. Now, those that reach out to me who have not seen a doctor or a dermatologist that don't have a diagnosis, then I will also work with a team of dermatologists that can provide us the diagnosis to be able to give that information to the individuals. And so receiving that diagnosis is so important because you're absolutely right. We can see different characteristics from the naked eye. However, having a clinical diagnosis actually helps us to identify the type of hair loss that it is, which in turn gives us the opportunity to provide solutions to address that type of hair loss. And so, whereas the diagnosis may not be um, easily accessible for everyone. And what I mean by that is a lot of times the dermatologists are very, very busy. Their books are full for months at a time. I've had several people to contact me because they cannot get into the dermatologist for months. And so they want to know, what can they do um, in the meantime? What can they do about their hair loss? What can they do about their scalp condition? And so um, we're able to provide that information to them here at our office as well to be able to give them that diagnosis and the solutions to address those problems.
Yeah, so I want to talk a little bit about how they contact you because you and I have had a previous discussion. Well, we've had a lot of discussions, but one of the things that really sticks out is it almost sounds as though you have a unique bedside manner that makes them feel more comfortable in discussing what's going on with them. So, can you talk a little bit more about that?
Yes, well, I get the privilege to be able to actually dig a little deeper than most um, professionals with hair loss. As a trichologist, the consultation is typically about an hour. And in that hour, we can deeply discuss what's been going on, what's happening now. We can identify the different things that we see under the microscope. The good thing is that we actually are able to show the individuals that are dealing with hair loss what's happening. And so they're able to see their scalp, they're able to see their follicles, and we can actually talk through how we can address this and how it can be more effective. And so a lot of it too is um, a lot of people are ashamed of hair loss. It's very personal. And so in order for them to open up and discuss the past and what has happened to lead to this point, they have to feel comfortable. having that conversation and that discussion. And so I do make it my priority to, one, connect with the person and understand, how important this is. I understand how important this is that they receive a solution, but more importantly, how it has affected them along this process. And so one of our main goals is to encourage and uplift and upbuild. And so if there's room for improvement, we definitely highlight those areas and encourage the person to continue to move forward so that they can stay on the road to recovery.
Right. So Taria says, yes, being able to make someone feel comfortable about talking about their issues is a key. Yeah, awesome. It's so funny. Little side note here. I'm looking at the comments and they are actually clearer today. So I was sharing with Donecia that after having some issues reading the comments, I went to the optometrist and got some Vuity drops. And I can say that it's helping me to see these comments better. And so, yeah, great. And then we have Perdita who has joined. So thank you for saying hello. We have, is it Abalori? I want to say it's Abalori. I apologize if I didn't say your name correctly, but thank you for joining. And Taria says, yay, about my drops that I can see a little better. I'm still in denial, y'all, when it comes to these darn glasses, but I actually got some prescription glasses coming. But okay, no, that was a little side note. But I do want to talk a little bit about some other things that we discussed, and that is the terminology when it comes to different professionals and how they describe things and how things can be misconstrued. And it's funny because even I find myself, and in preparing for this interview in particular, I found myself wanting to be very careful with my words because I didn't want to mislead anyone because I've had conversations on, with many different professionals. And I want to make sure that I mean what I say. And sometimes it's like easy to talk about your hair in a more, so non-scientific verbiage you can use, right? And so a lot of people talk about moisturize and hydration, and then they talk about it in terms of how the hair feels and not necessarily the state of the hair when it comes to having water molecules in it, which really, from a scientific perspective, is the definition of moisture or hydration. And so we find ourselves trying to be very careful in the way we choose our words. And one of the things that I find I always say serious and conscientious practitioners are the ones that I gravitate towards because I don't want anybody just saying anything that they want to say without thinking about the consequences of their words and how it could be taken. You don't want to mislead anyone, but at the same time, you want to be very respectful of other people's profession. And so, for example, if we talk about treatments, treatments from a physician is something that is probably, a pharmaceutical, and it's a particular technique or a drug treatment, so there are different ways to describe what we do in our own settings. Mm-hmm. So I want to ask you about how does that feel from a professional, you providing these services? You're not wanting to mislead the public, but at the same time, you want to still let them know that, hey, I'm here to support you in all the ways. So tell me about that internal struggle.
Okay. So it is a way with words. Because even as a clinical practitioner of trichology, right? So being a research assistant, I collect the data that is used in clinical research. And so whereas it's not a clinic like a hospital, however, the information is collected in for clinical purposes. And so treatments, we provide hair and scalp treatments and therapies in this line of business. It is considered a treatment because, and no, we may not use um, medicine, and I'm using air quotes on that because we may use hair and scalp um, products to address the hair and scalp concerns. And so someone may come in with damaged or broken hair. And so we use products and procedures to treat that situation, that damage or broken hair. We may have someone that come in with a scalp condition. And so there's a certain type of treatment that we use to address that scalp condition. And so it is definitely something that I think should be talked about more, is that yes, we provide a level of treatment, but it is not, and depending on the trichologist, their scope of practice, um, their regimen, it is a regimen. It is to address a concern. And so there has to be a series of events to properly address that. And so I know for me and my practice, we treat. That's the word we use, is treatment for different conditions. Um, I hope I answered that question.
Yeah. And so let's talk about that treatment, because a lot of times, so the state of the industry when it comes to bridging that gap between the trichologist and dermatologist, and we are going to have a show that focuses on that specifically upcoming soon. But I know that it's a struggle for a lot of trichologists, and it's almost like a catch-22, because the trichologists who are making the most noise out there in the industry, most of them give the profession of trichology a bad rep, right? I mean, there's a
Yeah,
lot of people saying a lot of things that shouldn't be said.
that's true.
But at the same time, what I've noticed, and why I, as a researcher, wanted to partner with serious and conscientious hair practitioners, is there are some things being done that are, I would say, helping people.
Mhm.
And I can tell that there is improvement in the health of the scalp with some, well, I would say anecdotally, so just looking from my own observation and not taking any measurements, it seems to be something there.
Mhm.
And so you have dermatology where they have tried and true. I mean, it's based on data, it's based on research, and a lot of times it's based on the pharmaceutical industry.
Mhm.
Not to say that there aren't some other uh, products out there that are useful, because one of the things that I seem to take notice of is when the regimen of the client changes, meaning that they are shampooing their hair more frequently.
Mhm.
There are some things that you can do with a cosmetic product that can help the scalp as well. And so my goal is to see what is working cosmetically, to really help the health of the scalp, so it makes it more conducive to grow hair. So it's not a drug where it is changing, the way that the cell, the makeup of the skin. It isn't necessarily changing that, but then it also seems to be this gray area, right? Because if you go into, or you look into the cosmetic aspect of it, when you cleanse your hair, you are removing some of the dead skin, right? And so
Okay.
the state of the scalp changes,
Mhm.
but it doesn't mean that it's drug induced, right? So it's
Right.
just like very careful line that we have to not cross,
Does the question is, does treatment have to be linked to the drugs? Like,
Right.
does it have to be a treatment because it is using a certain type of drug, when there are, in different fields, of course, there's different types of treatment. So there's physical therapy. There's a therapy, but it's a treatment for that condition. Um, if you will. I don't know if that was a good analogy, but does it really have to be a medical drug in order for it to be considered a treatment? Is the question.
So, so I don't think so, but it's interesting that you ask this because it brings me back to when I worked in the cosmetic industry, and we would oftentimes talk about the difference between treatments and processes. And just like beauty is in the eye of beholder, I think when you're in a particular field, you think of treatment being a particular thing. And so it's interesting to ponder because we want to be upfront about it and not confusing, but at the same time, you have to consider the lingo within the industry, right? So it's like, you know,
Right.
a balancing act, right?
Mm-hmm.
So Shirley McDonald says, totally agree. I trained with the Institute of Trichologists in London and now a clinical tutor as well as a practitioner. Unfortunately, anyone can call themselves a trichologist, and that is one of the main issues. Yeah, that is an issue. And I am determined, along with other professionals in the industry, I am determined to do something about that because it is a problem. And we have standards in other industries in terms of, not having, well, there are tiers, right? And so some tiers are more respected than others. And so it has to be something we can do. And I mean, I can't do it by myself, but
Right.
I am serious about joining along with others who can help to make sure that that isn't typical, right? And then Sydney says, I had the same questions because I feel like most of the drugs provided can increase it. Oh, so Sydney, are you talking about the drugs can increase the prevalence of alopecia or scalp problems? Can you dig a little deeper with that and explain it so I can make sure that we can address it? And I don't have a dermatologist on today, but that's something that I can have when we have our part two of the discussion talking about this bridge that needs to be in place between the trichologist and dermatologist. Yeah. So
Absolutely.
I want to talk a little bit more about your experience because I think a lot of people can learn from not only how clients come to you, but also your methodologies and helping them out. So I want to know, can you give like a story? Like, let's start with a heartwarming story because I think we talk about the problems a lot. So what stories do you have that just made your heart sing and you felt really proud to be providing the service that you do to your clients?
So I always get, just to see the hair rejuvenate, just to see it come up out of the scalp where there wasn't hair before, or to see those physical changes on the scalp to where this person may have had a dry, itchy scalp. And then they come back and they're like, oh my gosh, my hair looks so much better. It feels so much better. My scalp is not nearly as itchy as it was, or I'm not having those scalp conditions I was having. And I thought the situation I was in was permanent. So whenever I have someone that can see the benefit of proper scalp care, can see the results from addressing their scalp concerns, and now it's better than it was before, and they see improvement, I feel good about that. I feel like I'm doing my job. We're getting somewhere. Um, and just to see that hair being restored is a really, really good feeling. So, and I get to see that more often than not. And so that's what endears me to trichology, is to see, a person that can come in feeling hopeless, or feeling as though, their hair loss may not have any type of recovery, or just to feel bad or feel low. I don't want to say bad, but just to not feel good about themselves from the initial conversation. And then once we identify the problem and realize, okay, this is something we can work with, we can actually improve this situation. And to see that improvement, their confidence after that is priceless. I just love that. So that's the highlight for me.
Awesome. So, Shirley McDonald said that the Institute of Trichology is in the process of applying for registration with the Professional Standards Authority for allied health professionals. That's awesome. Now, here's the thing, Shirley, we do things here, and as you already know, we do things here in the US a little differently, right? And so things aren't necessarily transferable. So when you get something here in the United States, unless you go through, an accredited process of some sort, then a lot of times it's not respected overseas. Now, I have to say, because typically there are higher standards in the area of trichology overseas, and that is based on how the dermatologists actually see the actual educational background that, and the rigor that they have overseas. And so, based on that, it seems as though it's more well respected when the credentials come from overseas. And so, that really may not apply for here in the US, but I do know that there are issues internationally. So, it's great that there is a process because it is so important. So, thank you for letting us know that. Taria says that's such awesome work, talking about what you described. And then Shirley says you have to recognize when to refer. Recognize when to refer, I think, is one. I had great success treating cicatricial conditions. However, I have a duty to refer if I suspect there is still inflammation. What works is having a universal approach, cosmetic, medical, and nutrition based on the condition. Shirley McDonald says, yes, very true. And we now have an accredited course. That's awesome. That's awesome. So yes, Shirley, I agree. There, like I said, anecdotal, and that's why we're doing research. There is anecdotal evidence that when you cosmetically treat the scalp, that there can be some benefits. So I agree, there has to be that holistic approach. And when I say holistic, what I mean by that is more than one type of strategy. You can come at it from different angles, which I want to talk to you about, Donecia, because how do you implement the strategies from a physician? So if there is a topical ointment or solution that they have prescribed to their client, and oftentimes cosmetologists don't like the, I'll say, sensorial feel of a lot of the prescribed drugs for the scalp. And I mean, I can raise my hand to say that I had a cosmetologist. She hated using it because the condition that it would leave my hair in was absolutely horrible, even though it was decreasing the inflammation and irritation from my seborrheic dermatitis, because that's something that I suffer from. So how do you navigate that and balance what you do with what is prescribed by a dermatologist?
Okay. So anyone that has a prescription, we respect that. So if they have a diagnosis and they have been prescribed certain medications, we do not alter that. We do not try to change that in any way. And so I feel it's my obligation to understand the product or understand the drug that the person is having to use. That way I'll know what I can do on my end to help address the cosmetic part of it. And it is true, some of the prescribed medications, well, many of them don't address the hair. They typically address the scalp or the skin on the scalp. And so, the scalp. And so it may cause a drying effect to the hair, or the hair may not be as shiny or as moisturized as we would like. And so understanding the type of product or the type of medication helps me to better know, okay, so we may apply this to the scalp to address the scalp concern. However, we also have some holistic or natural derived products that we can use on the hair to give the hair the feel that it needs so that it can have that balance in body. And so we follow through with the medication that's been prescribed, but we also give options as far as the styling of the hair. And it seems to work really well.
Yeah. Yeah. One of the things I find myself doing, because in all honesty, the shampoo that works for my scalp and keeping my scalp healthy, it makes my hair feel like Brillo.
Mm-hmm.
I hate it.
That's common. That's
But
common.
yeah,
Yeah. But you
but
get
pardon?
but you get the scalp relief. And so
Yes,
yeah.
absolutely.
Mm-hmm.
And so, I feel that it's analogous to if a physician prescribes something that is for the scalp health, then there are ways that you can take care of your hair as well. And the way that I personally do it is I use a good conditioning shampoo
Mm-hmm.
afterwards. And I also concentrate the shampoo that is for my scalp on my scalp. And I try to avoid my hair at all costs. So, there are some techniques that can be used. And I'm glad to hear that you have been able to navigate in that space because it's important.
And sometimes just educating the client on that this particular medication is for the scalp, and so to apply it to the scalp. However, for the hair itself, it needs more support, so we provide that with the product for that, for the hair. And so back to the treatment, that would be a treatment regimen because you're having to do a processing in order to get a certain result.
Mhm.
And so, yeah, we do. We definitely support our dermatologists and doctors with whatever their prescribed regimen is for the individual.
Awesome. Great. Now, we talked about a heartwarming story. So,
Mhm.
can you talk about like something that is more heartbreaking? Um, there are stories that, I know of, hearing a lot of people's stories, but I'm curious about your unique experiences.
Uh, so because I take on the hair loss concerns so personally, I don't know. Um is near and dear to my heart. Um, the the individuals that I come in contact with, and so um, cases where this person wants their hair restored, however, it is beyond restoration. And they've been wearing extensions, they've been wearing weaves, they've been wearing different styles that actually have been contributing to more of the problem, been causing, contributing to the problem more so than helping it. So it's always heartbreaking to me when I have someone that comes in and we're beyond the restoration and that's what they really, really desire. And so we have to seriously talk about, you know, you may need hair replacement at this point versus hair restoration. And so um, sometimes that's hard for an individual to process. Hair loss is devastating. And so for them to actually process and they understand, okay, yes, I realize my hair loss has been going on for years, or I did do different services or products that didn't work, or um, time has gone on and it just wasn't addressed, or whatever the case is. Now we're here, and the option from here is actually a hair replacement option, and that may not have been what they really set out to do. And so um it gets to a point where it's either hair replacement, or, and I've had some ladies say, well, just shave it off. It's hard for me. I have to have the stone face and say, okay, if that's your decision, we can do that. We can move forward with that. Let's, just keep the scalp healthy as possible. But if you choose to shave it off because of the amount of hair loss, um, because I enjoy, and this is personal, because I enjoy seeing the hair regrow, but understanding that in this case it won't, and where this individual has decided to just shave it off. Um, it's an emotional thing. So for me, that's more, it pulls on my heartstrings a little bit more, um, in different cases like that.
Right. Wow. So, would you say that that's probably the number one thing that your clients struggle with is coming to terms with their hair, or their hair follicles have scarred over and will no longer grow hair?
Yes, yes. Um, and that is another reason why I like to be able to show them under the microscope. If you've never seen your scalp under the microscope and you're hopeful that the hair will grow, you're hopeful that, maybe this person has a solution. Maybe, I've tried this product, I've gone to this person, I've talked to this dermatologist. Sometimes they come to me even for a second opinion because they've heard that, okay, the hair won't regrow. But I like to take the opportunity to actually show them, from a microscopic viewpoint, why this hair will not regrow. This is what it looks like when your scalp is scarred or when that follicle has closed. And so, even though you've put forth all this effort to get it to regrow, at this point, this is where we are. And so accepting that is difficult. And then on the other end of that, a lot of times I have individuals that'll reach out to me that are experiencing hair loss and it's starting, but because they feel they could just apply a oil or some type of hair serum from the store, and they'll kind of put a band-aid on it and they'll keep going. So they'll continue doing, styles that are making the situation worse. And then when I talk to them about it, like, okay, this is where we are. We can get improvement, but we have to change our habits. We have to change those bad habits that are encouraging this. So, if the follicles are weak and the hair is weak, adding braids is not going to help. You don't want to put braids on it if it's already um, struggling to grow. And so sometimes that's hard for individuals to accept that, okay, I do have a hair loss concern that I could be making worse by my choices. And so having to identify that and accept it and realize, no, you won't be able to wear your braids anymore because now these follicles are sensitive. They're sensitive to that excess pulling and tugging. They're sensitive to you not shampooing it for a month or two at a time. That's going to continue this process of hair loss. And so in order for us to stop that, we have to change the behavior. And sometimes that's hard to process for individuals, especially if, they've been wearing a style to cover and they're getting by. Um, they don't want to make a change just yet. They feel like they have time. But again, that's where I have to be honest. In that consultation, we're open, we're vulnerable, but there is a level of honesty. We have to be honest and say, okay, well, if you continue this path, you're going to see me later, and then it could be a permanent situation. Do you want to be permanently in a hair replacement unit, or would you prefer to stop here and hopefully recover as much as possible? And so um, that's a decision, and that's a decision that they have to make. So, yeah.
I think you raise a good point in having an example of, what alternatives there are, because I know some people, well, to have easier access to the scalp, they will, as a woman, cut their hair low, because I'm actually really happy that women are feeling comfortable enough to embrace, hey, I'm gonna be beautiful with long hair, or even if it's, cut down low short. And
Yes.
to be honest with you, I've seen a lot of successes from people who just will start all over. I mean, if you have patches and, I don't want to talk about like alopecia areata, but if you have damage where you don't have a head full of hair, then sometimes if you cut it down low and like have it all grow out at the same time, you can, have a lot of success with that particular approach. And so it's devastating when people continue, like you said, to do the same thing over and over, which is exacerbating what's going on with their scalp health. And so, yeah, it's an issue. Now,
I would like to,
Anthony,
I'm sorry. I'm
no,
sorry to
no,
cut
I
you.
was just going to recognize Anthony Bridges. Thank you for the compliment. He says, great guys. Um, Rosetta says, yes, changing habits, that are inducing what's going on. And then Taria says, I love that you shared understanding the reasons why.
Yeah. And even with cutting it, so depending on the type of hair loss it is, um, cutting it may be a great option, but you still may need some more support. So whether it's, your products that you're using on the hair, or well, one, going back to the diagnosis. So that's really where it starts. So depending on the type of hair loss it is, that's going to determine how you move forward, not just today or tomorrow, but really for life, because that diagnosis helps you to identify what's going on. And so you'll know, okay, if I cut it short now, and then I go through the process of strengthening my hair, taking care of my scalp, if this is what I need to do for my hair to be healthy, then as it grows, it will continue to grow healthy. That's the idea. But depending on the type of hair loss that it is, you may need to address it a different way, but you won't know that, because I've had several cases where individuals were told that they have alopecia, not necessarily the type of alopecia, because there's alopecia means hair loss. That is the clinical name. But the type of alopecia will determine how you move forward. How do you address this? And that's so important, because you can pour all types of products on the hair, but if it's not addressing the problem, then it's not going to yield good results, or not lasting results. So getting that diagnosis and having that understanding is really key to knowing what to do moving forward.
So you basically answered my next question, and that was, what advice would you give hair loss sufferers? And that is, get a diagnosis.
Your diagnosis, and don't wait too late. Don't wait until you are in a situation to where you're so desperate that the options that you would like to have may not ever be available to you again. And I'm saying that in a loving way, that or an encouraging, I'm trying to be encouraging, because a lot of times when we start having hair loss, it can begin with shedding. It can begin with, patchiness, or it can begin with a style that we had. And yeah, I know the braids took my edges out, but I'm not worried about my edges coming back. But it has progressed because we never addressed it. And so I'm encouraging everyone that is experiencing hair loss, don't wait, years and years and years, and don't spend extra time and money just putting products on, hoping that they'll work. Find out what the problem is, get the correct diagnosis. That way you can address it moving forward, and then you'll have more options as far as what you can do for your hair loss.
Awesome. So we did say a diagnosis, but a diagnosis from a dermatologist. Let's
Yeah.
make that very clear. A diagnosis from you know what? I need to say board certified dermatologist.
Yes. Yes.
Awesome.
That's correct.
Now, speaking of that, one of the things that I'd like to talk about, it's almost difficult. So I'm glad that you have referrals from physicians, as you mentioned earlier. But sometimes it's hard for a trichologist to find a dermatologist who is willing to work with a trichologist. So we talked about bridge gapping or filling the gap with the bridge. But how have you been able to be successful in finding a dermatologist, or having physicians, really feel comfortable with the type of professional you are, because a lot of professionals are struggling out there?
Yes. So one key thing is that when I communicate with the dermatologist, um, I, I'm very clear that I support their diagnosis for the patient. And in support of that, I am also here to support the patient or the client with their hair loss concerns. And so we can work together as a team to support this individual who wants scalp and hair, their scalp and hair problems corrected. And so that's how I position myself to them, is that we're a team working to better the individuals that we service. And I don't cross over into their turf. And when it comes to hair, most dermatologists, unless they specialize in hair loss or specialize in hair, most of them don't deal with the hair. And so it gives them a sense of relief that they can actually refer their clients to someone who can help manage this client or this person's problem. And then they can actually be seen by them for follow-ups. But I am more so on the management team that helps to support that client with their hair loss concerns. And it works. It works.
Awesome. Well, you definitely have a great model for others to look at so that they can have success in collaboration as well, because that really is key in having the best outcomes. I really do feel that. That's great. So Demetria Hayden says, great conversation and a very well needed conversation. Thank you. Perdita says, great information as well. Thank you. And then Dr. Carmela Nanton says, great advice. Thank you. Really appreciate that. So we are approaching the end of our interview and conversation. But if you have any questions, make sure you put them in the chat before we go. But before we end, I'd like to know how can people reach you?
Awesome. So I am at Hair and Beauty Treatment Center in Augusta, Georgia. However, I do consult remotely and treat remotely. And so you can reach me at www.thehbtc.com, which is our website for more information, or you can give us a call at 706-373-9184. We'll be glad to help you.
Say it one more time.
Okay. So the website is www.thehbtc, that is THEHBTC.com, or the phone number 706-373-9184.
Awesome. Appreciate that. Now, the one thing we did mention that she was a research assistant, but one of the things I want to highlight, because Donecia has been collecting data. I mean, she's really been collecting data. Yay!
So excited.
So one of the, and you know what, it took me a while to see what was on your side. You actually have main insights patch.
So yes, I do.
Yes. So as a research assistant, yeah, Donecia has been collecting her data, and I expect this time next year, we will not only have like case studies about what's been going on, we will have some actual data that we will be able to talk about in terms of things that went right, what went wrong. And I think that will help others to appreciate the science and the research. And for main insights, the goal and the whole purpose of it is to get those insights about the mane, about the hair. And so I really encourage any professional out there who is into research, who have ideas, to reach out to those who have been qualified and certified to actually do research, because I think that's the only way that we will elevate the industry. But also in terms of building that bridge that we need. I was telling my practitioners a long time ago, I was like, I think things are so bad between the relationship between the dermatologist and the trichologist that the only way we can build that bridge, well, in addition to some other strategies I have in mind, but the thing is to have some data, excuse me, to show that what you are doing helps.
Yes.
And so having that data that is respected by a lot of physicians, and that is what Donecia is well on her way of being able to provide. And so I applaud you and I thank you for being serious about that.
Thank you. Thank you for the opportunity. I agree. It is definitely needed because we need to know what works and what's not working and how we can help people more. So I encourage trichologists, that getting the data behind it, behind your process and your services makes all the difference. Because you have the information to show how well your process works and how you can help people. So I say, come on, join us.
Yeah, join movement. All right. So I don't see any other questions. Is there any last minute words that you have before we?
Well, I just want to thank you. Thank you for having me. This has definitely been a pleasure. So I look forward to more lunchtime chats.
Awesome. Well, hats off to you for helping to move the needle when it comes to service options, conducting research, and providing care. So thanks. So oftentimes some of you want to reply or you watch the replay and you want to reply or you have questions. So let's keep the conversation going. And if you haven't done so already, please join the Our Black Hair Matters movement group on Facebook. And you can put your questions or comments in the chat and we always get back to you. So some of you may even want to find a vetted professional. Donecia is one of those professionals. And so if you want to schedule a consultation, you can go to OBHM Consult, I should say bit.ly, OBHM Consult, and you can schedule an appointment. So thank you guys for joining. And always remember that our Black hair matters. And as always, take care and love your hair. Bye-bye.